Great. I want to thank Karen and thank you all for inviting me to this meeting today. I certainly am happy to see more expansion of the One Health concept and ideas and really merging. This is a perfect forum to have agriculture and public health, and I think this is one of the best examples. And you've kind of heard a lot of the challenges already to this already challenging disease, but certainly I'll show you certainly. This is one of the most challenging diseases, I think, both for human health and animal health. So I'm not going to go too much to the background since I know we're kind of pressed for time, and I think Mr. Maddox did an excellent job kind of summarizing the situation and issues. I kind of want to expand upon that a little bit more from a public health perspective and talk a little bit more about some of the prevention strategies and challenges that we've experienced, and then also talk about some of the occupational health issues, which you did a great job touching upon already. M. bovis is part of the MTB complex. And transmission used to be more common from cattle to humans, typically through milk. But because of all the excellent work you guys have done as far as controlling disease in cattle herds, and with routine pasteurization, the incidence has really decreased markedly in the United States. Now the majority of cases of M. bovis are typically imported cases when people have either grown up or were born or traveled to countries where the infection is much more prevalent in cattle. So in the U.S. now, we basically just see regional presence within the U.S. communities typically with larger Hispanic populations, and a strong association with consumption or importation of contaminated dairy products or unpasteurized or raw dairy products, which will continue to be a concern, I think, for us, especially in California. So I think this One Health approach with MTB is a really nice model because it involves the intersection between public health, animal agriculture, and also potential wildlife as well. I'm not going to go too much in the wildlife aspects today, but because I know that in some other countries and in parts of the United States, again, wildlife can play more of a role. But I think we're just going to focus more on the public health and cattle aspects for today. So again, we're up against, you've heard a lot of different bugs discussed this afternoon, but again, this is a really challenging one for multiple reasons. Again, it can affect multiple species. It's not just a single species. Again, we certainly, cattle are a reservoir, but we certainly see spread to human to human spread to wildlife, spread to multiple animal species. So again, very difficult in the spectrum of different zoonotic diseases. Has a very long incubation period, years. So again, it's not like something we can just quarantine and wait, a short period of time and say the animal's free or they're not going to get sick. It has an insidious disease onset. Animal just doesn't get, outwardly ill and die. And there's multiple forms of the disease, so it makes detection difficult, and you can have this potentially an infected person or animal, get exposed, and then many years later develop the disease. As mentioned by Mr. Maddox, again, we have limited diagnostic tools as well. Again, we discussed some of the tests already, but again, our diagnostics are not always the most reliable. We have to do multiple methods to kind of get a sense of whether this is positive or not, and again, it's to do definitive culture, to do genetic analysis and more molecular characterization requires a culture, which again takes many weeks to months to actually get. So from a laboratory perspective too, again, it's a very challenging bug. And again, prevention programs, again, are very expensive, very labor intensive, as I think we've outlined as well. The program already that's to do screening and surveillance, again, it's very labor intensive. To have to test and then go back and read every single animal and then do follow-up testing, again, very labor intensive. Again, the threat of a potential wildlife reservoir only adds to this complexity. And again, the disease has a high prevalence in many other countries and neighboring countries, especially including Mexico. So again, we have a lot of these disease threats right on our doorstep, in a sense, that we're also faced against. So again, for these reasons, M. bovis is much more challenging than the many other diseases I think we face. So we have to look about, what's the probability that disease is going to be transmitted? Because a lot of these factors help to determine whether transmission actually occurs or not. And some of the factors include, I just listed, the infectiousness, or how infectious the person or animal is with TB, the environment and type of exposure scenarios, the duration or frequency of the exposure, and then the virulence of the organism. So again, it's a complex factor. It's not always that, a single exposure is going to result in disease. And again, there's a lot of complex factors at work here when there's interactions between different animals and people. So we were looking at potential, we talked about cattle-to-cattle transmission, human-to-human transmission, transmission from cattle to humans, again, typically through consumption of raw dairy products or lesser extent inhalation of infectious droplets from cattle. And then also the potential for human-to-cattle transmission. So again, a reverse zoonosis, or basically you can see every permutation of transmission, it can occur. Again, looking at, again, the foodborne from the human public health perspective, again, foodborne is probably our biggest concern, again, ingestion of contaminated unpasteurized dairy products. In California, we have, and I guess it's more problem outside of California as well, again, importation of unsafe, unpasteurized products produced in other countries, very popular products, queso fresco. Multiple disease pathogens can be associated with it, and again, it's an ongoing problem that we face in border states, but certainly and throughout, it's a very popular product and gets imported illegally throughout the country, I believe. So this is just a slide I stole from an article that kind of shows the different types of routes of transmission and the relative risk of how the probability that transmission occurs. So the thickest arrow, cattle to cattle, is probably how most likely the disease moves. Lesser extent can go from animal to human, lesser amount from human to human, and then again a smaller line again from human to cattle. So again, every kind of direction can occur, but again the relative probabilities are significantly different. When we talk about human disease, again, there's a big difference between infection versus disease. A lot of people can be infected, but not everybody's going to develop the actual disease. And it's managed from the public health standpoint very similar or basically identically to tuberculosis or the human TB. I used to work at the Sacramento County Health Department for over a year in the TB clinic, seeing all the human cases and doing all the follow-up and extensive contact investigation. So I can tell you firsthand, again, there's no difference if it's M. bovis versus MTB from a management side, but certainly from tracing back to a source, again, it's a little bit different. Some of the differences are that M. bovis in people is more likely to cause an extrapulmonary disease, which means just over half of the cases with human cases with M. bovis are likely not to have the disease in the lungs, but it's typically maybe in the neck or other parts of their body. So that makes it a little bit more difficult as well. I mean, they're likely not to transmit it unless it's pulmonary, but again, doing just a simple chest x-ray may not rule out that they have TB in other parts of their body. And again, certain conditions increase the risk of infection or progression to disease. So certain people may be more susceptible, just like certain animals may be more susceptible, including persons co-infected with HIV or potentially children. In humans, some of the similar tests done in animals as well. Again, skin testing, followed by potential blood testing, culture, chest x-ray, again, a whole myriad of tests. So again, you can tell how complex this is. Interpretation of these tests, so the costs and times and things really add up. We know M. bovis is almost always resistant to pyrazinamide, which is the first-line TB drug for a typical treating tuberculosis. So that's why if you're being treated if you have M. bovis infection, you would need at least a 9-month treatment duration because you need additional antibiotics because you can't use the PCA. And it's also some significance is that people infected with M. bovis have a slightly higher mortality rate compared to treatment with M. tuberculosis. So it can be a potentially more deadly disease as well. This is talking about what are some of the health department responsibilities, and I think Mr. Maddox did an excellent job kind of characterizing some of the differences in approaches from a health department versus from an animal health perspective. The health departments typically are given resources, again, to investigate contacts in most need of treatment to prevent further transmission human to human. And again, so they monitor the treatment. They make sure that people that have been exposed, they get, or our actual cases actually get treated adequately, to the extent where we go every day, a public health nurse goes out to their home and watches them take the TB drugs. And that's why we've been able to keep our TB incidence rate relatively, it has been decreasing, but certainly we certainly have pressures from importation, immigrants, and other factors such as ongoing outbreaks. Just in California, just to get a perspective, the relative numbers of bovis cases that occur versus regular human TB, again, only 2 to 4% of our total TB cases statewide are due to actually M. bovis. So it actually represents a very small percentage of MTB, of tuberculosis cases in humans. So that's why, again, health departments are focused on the 98%, which is human tuberculosis, which is more efficiently spread human to human. And that's why a lot of the resources, training, and everything is geared towards the human TB. So in California, again, we don't get that many cases. We get approximately 70 cases a year. And overall, with such a large state, again, it's not a huge proportion. It's typically found in Southern California counties. No surprise, since they have a lot of immigrants, particularly from Mexico. We see M. bovis infection more common in children than adults, typically because children are given raw dairy products from contaminated sources when they're very young. Okay, and then again, and as seen in other places, again, I can reemphasize again a lot of the high percentage of cases in Hispanic ethnicities. So when we go to prevention, again, we have to prevent all those different arrows of how the disease may be transmitted. So again, it's a multi-pronged approach. Again, certainly the cattle-to-cattle transmission you're all familiar with. I'm not going to go into that. I'm not the expert in that, but certainly I know there's been new USDA approaches for management, talking about, reducing introduction into a herd, from looking at importation from Mexico, wildlife, enhancing surveillance, different strategies for managing affected herds, and a myriad of things which I'm sure you're all going to be providing comment on. Certainly from the human side, human-to-human transmission, there's really nothing specific for M. bovis, since it's transmitted from human to human, very similar if you have the pulmonary form of the disease. So it's basically, and the human strategies, again, is focused on early disease detection and screening. And again, for immigrants coming into the United States, again, there is a requirement for TB screening as well. There's a rapid case contact investigation and treatment of exposed or ill persons. So when we look at kind of the cross-species prevention methods, measures, again, there's certainly the education has been out there, and again, avoiding consumption of unpasteurized dairy products. Again, we'll hear that over and over, especially in areas endemic for bovine tuberculosis or for travelers. And can't do enough, I guess, of enough outreach, especially in high-risk areas, to educate people not to consume these products. However, there's a very strong passion, there's a very strong drive for a lot of these people who've grown up in foreign countries to eat unpasteurized dairy products or raw milk, to continue to do so despite all the health risk. And we heard from the other sessions too, again, people are still going to do it, I think. Effective animal surveillance and eradication efforts have really minimized exposure to dairy workers. So if you look at all of our cases that we see, none of them are dairy workers. And then we certainly doing exposure contact investigations treatment really minimizes any of the transmission. In some of the new areas, again, surveillance, laboratory genotyping really is giving us more information to see which direction the potential transmission could be going, but certainly I think a lot more robust efforts on that are up and coming. And then certainly if certain protective equipment can be implemented if workers are working in higher risk situations with cattle, such as in the laboratory or doing depopulation efforts, for example, with infected animals. So we're looking, I think, mostly today somewhat on the potential for human-to-cattle transmission and how would you prevent this kind of arrow. Again, in the larger aspects, it's a smaller portion, but again, in the overall TB prevention, again, it's certainly one piece of the puzzle. So I think you did. I must have copied your slides, but again, having healthy workers again certainly is going to be key, because if you have a healthy worker, then you're not going to have transmission from human to cattle. Other strategies can be used, again, having workers not work with a lot of other herds compared to your herd, because then if they may get exposed other places and then bring things back. And certainly the education training can't emphasize enough, again, for workers not to do things that may contaminate feed. They should be aware of the signs of TB disease, so also in case of if any of their family members get sick. And then, again, avoiding high-risk exposure, high-risk practices, such as, again, consuming raw dairy products. Again, if you can teach them to protect themselves, then they will serve as a buffer and then also protect your herd. And then routine, sanitation and hygiene is always a good idea as well. So I just have a couple slides about the public health response in California. We heard a lot more details earlier. Again, certainly the quarantine, extensive animal testing and tracing and depopulation efforts certainly were able to stop the outbreak. And we did, the public health did exposure investigations at 2 of the 3 dairies. So that involved, again, worker questionnaire, skin testing, follow-up testing, which was not maybe is done to the extent to really completely rule out a human as a source. And also latent infection treatment was performed in some of the instances. Not always done or picked up by public health. Local health departments, basically, it's a decision based upon the resources and priorities, again, with very shrinking public health dollars. And I think at the same time, there was at least 2 large outbreaks going on in the human population at that time, too. So they were very stretched thin as well. And again, a lot of decisions end up being political, or it's a very local decision. And again, they're given certain priorities. And again, when they're having active human-to-human transmission in schools, in nursing home facilities, what is going to be the priority? Are you going to try to assess all these people that may have been exposed to, working with a dairy that may have had that had 1 positive animal, to do all the necessary extent, and basically there's only so much lab capacity they have as well. So again, I can't speak for Fresno or how they responded. We urge them to to try to solve some of these questions for us, and they weren't able to do so. But based upon the testing that was performed, again, no active human cases were identified. However, and I can talk to Steve afterward. Again, given the time periods too, again, we have some potential concerns as well. As there may be employees that may not been able to be reached to be tested, so we don't always have a complete picture, or we're always testing after the fact. So there may be a great time lag. So we could potentially miss someone. So we can't conclusively rule out potential human to cattle transmission. Some of the lessons we learned from a public health perspective, again, potential turnover of workers, many potentially for loss for follow-up or for further follow-up testing. Some had prior vaccination, which complicates some of the skin testing. There is no really national kind of standardized protocol for investigation for dairy workers. We kind of use the approach similar how we would investigate any human exposure scenario, which I think we may need to have a subset investigation protocol, since obviously working in a dairy has different or unique kind of potentials for exposures. And again, the public health investigation is focused primarily on assessing humans to see if they've been exposed to cattle, not the reverse. But then through the testing, though, we can actually learn a lot of information to see if the potential source could be a human. And we did experience certainly resource limitations. So fortunately, we did have good cooperation working with our agriculture departments and our dairy owners. But certainly, again, we need to clearly define the role of public health and the goal of the investigation, and make it clear up front what the expectations are and what the resources are, and kind of how they're proportioned out, I think. And then I think using the genotyping databases to make cross-links and building up those information, I think will really help to put us in a better position if this is ever detected in the future. Some of the occupational health issues, again, to protect workers is focused, again, to mitigate hazards and protect the worker, so it's not necessarily the reverse direction. Again, cattle workers, veterinary staff, slaughterhouse workers, laboratory workers may be at risk. Let's see. So certainly the cattle surveillance efforts certainly obviously identify the potential exposure risks to the workers, and generally we consider it not a concern for general everyday when there's no suspect animals present. But certainly if suspect or confirmed animals are present, there may be additional needs for protective equipment or additional training. So basically the question comes down to, should we screen workers to protect the cattle herd? Again, from an animal health perspective, certainly it makes sense, again, as part of one piece of the puzzle among the many other things to protect your herd. It does entail, though, again, having a comprehensive occupational health program, training and education, and then the screening costs, again, and some of the issues you may encounter, again, doing the screening include, having a higher likelihood of positive skin tests. Again, that's our initial screening test, and because of in some instances, there may be a higher likelihood of workers being foreign-born, which may result in higher likelihood of skin test positive. So, again, you have to prepare for that. Again, you would have to have all the staff get a medical evaluation and then potentially long-term treatment for latent infection. Again, I mentioned antibiotics for over 9 months. And then have an ongoing screening program, monitoring program, again, testing every 1 or 2 years, for example, to see if there's any conversions. Again, with the skin testing, again, is a challenge. Again, it's not the best test. Again, mentioned high BRCA levels in foreign-born workers. And also, if you get a positive skin test, it's most likely that it's due to exposure to M. tuberculosis, not M. bovis. So again, you're going to be picking up a lot of MTB cases, which aren't very likely to be transmitted to cattle. And then any positive skin tests, again, there's a whole myriad of additional tests that follow, and including potential treatment. So again, you kind of go down the path of potentially additional costs. And it may be a low yield. Again, approximately 5 to 10% of persons with positive skin tests actually will develop the disease. So from a perspective like that, the probability is low, but it's still there. And again, certainly if you've seen the severe economic damage that even one positive cow can do, so weighing those costs, it may be effective from an animal health perspective. So when, again, talking about screening workers, again, there is no national recommendations for this from CDC or anything else that I could find. It may be problematic. There may be costly with a low yield. When we looked at our human cases, again, at least in California, we did a quick review. Again, most of our cases occur in children, which are not dairy workers. But of the eligible kind of age group that may be could be a worker, again, we didn't find any active cases among dairy workers. So either it's underreported, or we're not recognizing it, or it's just rare. But certainly there are some positive benefits that if you did have prior testing data, that if there was a detection at a farm, we can certainly use that information to help guide our public health investigation if bovine TB was found in the cattle, but heaven forbid that ever occurs. And then there have been concerns raised about potential discrimination if you screen prior to hiring. But again, I'm not the occupational health lawyer, but that has been raised before and in other settings as well. And then potentially worker turnover rate. If you go through expense and to treat and do all these things for the person and then they leave, potentially have to replace that person, as well as what is the implication if you had a worker who had a negative skin test and then a couple years it turns positive? What does that mean? And you do further follow-up testing. Does that mean would that have any impact on how you would manage your herd? Would you have to test the cattle in light of having a positive human? So does it trigger other things? So just thinking about those, what are you going to do with the positive results or kind of inconclusive results? And then using as a model, certain, other facilities already screen workers for TB, typically lab animal facilities or universities. That's ongoing, to do TB screening annually as part of the occupational health program, typically facilities dealing with non-human primates. And again, but those, again, are goals of preventing, human to animal transmission and also having baseline data in case there is an outbreak or potential human exposure to assess if they convert or not. So some of the future steps, again, we're looking forward to potentially development of better or improved laboratory testing, again, more sensitive, more specific, and more timely. Certainly genotyping is still going to be a good epidemiologic tool to help link, clusters or outbreaks or, where the sources may have come from, including getting isolates from Mexico or other countries, and then obviously continued collaboration between animal and public health, and that's why we're here today. We just finished putting in a proposal last week with CDC, and hopefully we'll get funded with several other border states to improve M-bovis surveillance in humans, knowledge and prevention strategies, and this also includes a portion working with bordering Mexico states, again, so we can get more data of what's going on across the border to help prevent and see what's going on here in the United States as well. So in conclusion, again, M-bovis is relatively a rare disease in the United States, but it has significant economic and health impacts. It's a complicated disease primarily reported in Hispanic children in the United States. Contact investigations of dairy workers to this point have not found a human source, although they were not done as extensively to really completely say conclusively that they were not a source. Protections can be taken to protect workers in higher risk situations, and certainly training and education of workers is beneficial. And screening of workers is controversial, depending who you talk to, but it sounds like through a good example of we've had it from California, I think if it's done right, it sounds like it can work. So we'd be certainly looking forward as a role model to see how good it's working. We'll be monitoring that, and certainly I've heard anecdotally, other places throughout the nation starting to think about this, starting to do it, but I don't think it's a standard of practice.